This is it's getting to be late summer and into autumn, and with our children going back to school, high school football games and soccer games and whatnot, there's a large concern for things like injury, for kids in school being bright and being on their game academically, and just a concern for the general well-being of the whole person, that holistic approach. And we've often talked about holistic medicine. So I just want to touch on a few things tonight that would be of great interest to you. And I'll say this in the way of a testimonial, if you will. If you'll give me that opportunity and grace me with your presence as I speak about this. Years ago, back in the day when I was a little thinner and weighed less pounds, I had a wonderful scholarship to an Ivy League school to play basketball. And during that time, however, I injured my left knee. Wouldn't you know, genetics as they are, I came down to a time in my life later on where I began expressing what we call phenotypically, like the expression of genes that were in my family that had to do with diabetes. Now, if you know anything about diabetes, do you know somebody who's got diabetes? Somebody in the family, a friend, somebody, a colleague at work? Well, diabetics, when your blood sugar gets way out of control, they become very acidic. Many times your joints start to suffer. Well, everything starts to suffer. I mean, your coronary arteries begin to suffer, and coronary artery disease picks up even more than the average population. Well, your joints also literally get eaten up. For instance, in a knee where there's a meniscus, which is a padding, it's a cartilaginous padding, that actually gets dissolved. And for a fellow like me, my left knee from previous basketball injury and also diabetes makes it so I have no cartilage at all. And some days it acts up terribly and I have a lot of pain. Lo and behold, being a part of being on the advisory board for Green Organics International and being familiar with some of these products, as you've heard me before, I said, I'm going to try. It's called Wounded Warrior. And historically, I've been sort of that weekend warrior like many fellows are and women are. And that left knee started to really act up. Let me tell you, I couldn't even walk on it last week. It was horrible, the pain. And I'm thinking, gee, do I need to go to my orthopedic surgeon? Do I need to see my family physician? And I thought to myself, wait a second, physician, heal thyself. And let's take a moment here. So I came to a wonderful meeting, actually it was 2 weeks ago, here on the WholeBody Collection, and I picked up a bottle of the Wounded Warrior, and I put that essential oil in, that beautiful blend, I put that in and on my left knee, and I did that twice a day. And I began getting actually relief from the very first time I used it, but within 3 days, I had no pain. I was able to flex my knee probably another 45 degrees. It was phenomenal. And then I stopped and I thought to myself, I don't have to explain this to everyone, the chemistry and the physics behind these essential oils, but there's a wonderful energy, I'll put it that way, an energy that gets into the skin and goes right down into the joint, also gets picked up by the capillary bed, by your venules then, and are carried also in your bloodstream to a small amount, which gives relief all over the body, but specifically to that area of the body where it is applied. And it's one of the wonderful things I found out from these essential oils, these wonderful blends. And again, Alexandria Brighton put these together in just a masterful way. The brilliance of it all is almost beyond me as a physician, but I do understand how they work and why they work and where they work and how darn good they are for you. So Wounded Warrior I've used. Now I came across another secret. Attending as much as I could of the WholeBody Collection meeting that was here just 2 weekends ago, I began using the whole body. And this is very important, also as a diabetic. And I only bring that up because 1 out of 6 of you are diabetic. And if you're an adult, and I'm speaking to adults, that's going to ramp up very soon to 1 out of 4 to as much as 1 out of 3 during the next 1 or 2 decades. every third person that you're sitting by is going to have diabetes. Now, 50% of type 2 diabetics in the United States, of which is about 30 million, and there's another 59 pre-diabetics on the way, but 15 million diabetics have neuropathy. That's where there's pain in the toes and in your feet, and it's severe pain. I had such severe pain that I could not even put the sheet on my feet at nighttime, and I had to take medicine, and I had to take maximum capsules of this medicine to even try to get to sleep and not wake up at least for about 3 or 4 hours, so I get some at least decent sleep. Well, you know what I did? I could have used the Wounded Warrior, and that was a good place to use it, but I said to myself, I'm going to try WholeBody. I'm going to try this wonderful collection. Let me show this to you as well. It's a great pamphlet that they've put out on this. Very informational. Well, you need to get this. This is a tremendous piece of work. Congratulations for the staff that put this together. But what the WholeBody Collection is a collection of various oils and blends that have different functions. Now, your body doesn't decide. It doesn't think, hey, we're going to do this today. It responds. It responds to environmental stimuli. There's a wonderful signaling that goes on in the body, and we think that the signaling really right now is actually quicker than even electrical pulse signaling, which is incredible. That from the top of your head to your little toe, your body actually can signal from cell to cell, from an organ to organ, from the brain to an organ, from the organ to the brain, from your skin all the way through right to the middle of your heart, on the septum that divides those 4 chambers. The body responds to each other as well. So it responds to stimuli coming from the outside, then it responds to itself. Likewise, when natural oils from plant strong, I love it, when natural oils that are pure are put together and then placed on an elbow hurt, on a knee hurt, they actually go in and they take their place amongst all of the other cells. They take their place in influencing those cells and influencing those tissues for the better. I don't understand this. Does this get into metaphysics or something of that sort? You might say so. Doggone it, they work. And for me, they work. So I'm sitting here as a physician saying, wait a second, Wounded Warrior really worked on my left knee. And the different blends in the whole body helped align my system, help my circulatory system get really well fed and work well, so that my little tiny arterial capillaries could deliver oxygen to those little tiny nerves in my feet. Because you know what happens with diabetics. We lose our toes, then we lose below the ankle, then we lose below the knee, and all of a sudden the surgeon's cutting off our legs totally. We end up in a wheelchair, and because of that, we actually pass away soon thereafter. I don't want that happening to you or to me. So what I did was, let me move on quickly here, is I employed this. I looked at this. I had somebody in the conference actually treat me. Now, that's a physician term. That's not a green organics term, okay? They actually applied it like they're supposed to give me some sort of relief and to do the work that natural oils do. So they did. And in about, no kidding, in about 15 minutes after I went through and had these oils applied, and let me read, I'm going to put on my glasses here with my favorite camo attachments there, but let me just go over these really soon. When they actually did a line that helped me walk correctly and align the body, and also the osteo, the bones that were in those little toes, all right, big toes, and sensory, which was applied directly to the sensory system. The little tiny cerebral nerves, we call them, that make your skin and joints healthy and workable, flexible, that affects the muscular system. Think of where your muscles are in your joint here, right? To open and close your mouth. Your hands, your flexor tendons and extensor tendons, so the radialis and all of that. And everything we do, the flexion, very, very important. So flexible for the muscular system. It connects the systems. You have ligaments that will attach a bone to a bone, You have tendons that attach muscle to a bone, and you also have cartilage, like in your ear, right here, the tragus and antitragus, and cartilage in your knee. So the Connect helps those connectors work well and stay nice and nimble. And then Circulate, of course, which helps the heart, helps this pump, and also helps your entire 60,000 miles of vasculature, your veins and your arteries. And I tell you, so this is a system, and again, there are 7 oils, and you use them in line, and you actually get to evaluate yourself according to a system. And it's very easy. It is so simple. It's incredible. And so you do that, and then you apply the oils in the area of the base of the big toe. They show you exactly how to do it. And so what can you expect? And let me read this off to you, because I want to do it the exact right way. What can you expect? Okay, one can expect relief from acute and chronic pain. Okay, why? Not because we're saying this oil does that. It's because we know that the blends that are coming out of plants have done this for ages, 6,000 years back to Egyptian times. These are recorded. Deep relaxation, emotional relief, relief from tension. That's a big one in this day and age. Restored circulation, reconnection to the body. That is renewed appreciation for being able to move, just to be able to move and feel good. Bones mend more quickly. That's a big one. For osteoporosis is stopped in its tracks. I had a very large osteoporosis practice in the state of Ohio. And well, I know how debilitating it is when all of a sudden, grandma or even mom gets a hip fracture or a Colles fracture, where you fracture your wrist just from falling down, from a basic height level. Very important that we keep our bones strong, and this helps as well. And then healing from accidents and injuries and things like that. So these 7 oils are very important for health. I found that out. And I will say, as a testimonial, when I was having severe pain in my feet, which is a progressive process that ends up in amputation, I had to get on the stick with this. And I literally went and I used the WholeBody Collection. Go online and learn more about this, because I tell you, it's absolutely worth your time. Okay? Now I want to close with this. I reflected a moment on children, kids, and in high school, college kids, and injuries. Okay, and Jason or Rita or whoever's in your family comes home and they're just really sore. They've had one heck of a workout and they're sore. The oils will help to bring relief. Put it that way. Okay. Now we talk about integrated medicine. We're not saying oils are the only thing. Pharmacologics are the only thing. Surgery is the only thing. There's a wonderful integration among disciplines in medicine. This certainly is an integral part of this. As far as I'm concerned, my family, for me as well, will use the essential oils by Alexandria Brighton. Why? Because I'm pragmatic as a physician. They work. It's as simple and easy as that. So when kids are in sports, especially during this fall and winter and into the spring, you might think, but don't think twice. Think about using a WholeBody Collection. Think about educating yourself with some of these other oils. And I would tell you again, the Wounded Warrior is really something else. It helped me tremendously, as did the entire WholeBody Collection, to be more of who I was meant to be as I live out my own DNA. So thanks very much for listening in tonight. Please get online, find out about this. This will be a lifesaver for your family. Good night.